at 9:05 a.m. on September 13th at the Health Licensing Office in Salem, Oregon by telephone conference call. I will now call roll. Maggie Hilty.
Here.
Christine Prather.
Here.
Catherine Kalanick.
Here.
Carol Hankins.
Here.
Samuel Weiss. And Jennifer Brodbeck.
Here.
Members, when you wish to speak, please state your last name for the record. Board members are asked to not use the chat features during meetings. Public members wishing to speak must first sign in on the roster sheet available. For public members calling in on the public phone line, please email April Fleming at dhsoha.state.org.us and provide your first and last name. Public and interested parties feedback may be heard during the public interested parties feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. This meeting is called to order.
Hi, good morning. Thank you very much. So the first thing we have on the item or for items to do is approval of the agenda.
This is Maggie Hilty. I move to approve the agenda.
Hankins, second.
And then we'll need a roll call. Amy?
Yes. We have a motion to approve the minutes of the Long-Term Care Administrators Board. Those in favor, Maggie Hilty.
Aye.
Christine Prather.
Yay.
Catherine Kalanick.
Yay.
Carol Hankins.
Yay.
Samuel Weiss.
Yay.
And Jennifer Brodbeck.
Yay.
And this is Bob. For clarification, you said minutes. It's the agenda.
I'm sorry for correction to approve the agenda. Should I call the roll again?
No, I think we're fine.
Okay.
Next on the agenda are some introductions. So Carol, if you would tell us a little bit about yourself and introduce yourself, please.
Hi, I'm Carol Hankins. I live in Newberg, Oregon. I was a long-term care ombudsman for 9 years, and I'm very happy to be on the board.
Okay. And Jennifer?
Good morning, everyone. I'm Jennifer Brodbeck, 25 years in healthcare and a licensed long-term care administrator myself. I'm very happy to be part of the board and meet all of you fine folks.
Thank you. And Mr. Weiss?
Hi, I'm Samuel Weiss. I live in the Raleigh Hills area of Portland. I've been a certified long-term care ombudsman for over 18 years and have spent much time encouraging licensing of administrators. So it's a real pleasure to be part of the process to now monitor and maintain the efforts to accomplish that.
Okay, thank you very much. So we'll go around the computer screen just in brief. We'll introduce the folks that are pertinent to this board today, starting with myself. And for those of you who don't know me, my name is Bob Bothwell. I'm now the interim director. Sylvie has gone on to sunny, brighter pastures in Arizona. Hot, I guess I should add in there too. And I've been with the office just about 11 years, and I come from 20 plus years in law enforcement and corrections doing investigations. And to my right, I have Ann Thompson, and I believe all the new folks met with her this morning. And also pertinent is our licensing manager, Tina Russell. Tina, you want to give us a little bit about yourself if you're available? And you're muted.
Good morning, everybody. My name's Tina Russell. I'm the licensing manager here. I've been in the office working here 26 years come September. And I'm always available to help you guys in anything that you need. And that's all.
Okay. April Fleming, she's here. Everybody's received emails from her. She apparently doesn't have a microphone. So April's been here how long? Almost 10 years. And she's worked in regulatory, and now she's, what's your title? Board specialist? Oh, and licensing. So she's very well rounded here in the office. Next we have Trampus Shuck. Trampus, you want to pop on and introduce yourself, please?
Hello, everyone. My name is Trampus Shuck. I'm the interim regulatory investigator. When Bob was took over for Sylvie, I took over for him, and I've been with the agency or office for 14 years. Most of those years were spent in investigation. Some of them were in policy and some other areas, but the vast majority of them were in regulatory. And yeah, I'm happy to have all of you here.
Okay, Sarah, are you on the line? I see your picture. Almost.
Oh, can you hear me?
Yes, thank you.
I guess my camera's not working. It's black, so I tried to turn it on. So my name is Sarah Hearn, and I have been with Health Licensing Office for about 8 years. I started as an administrative assistant for about a year. Then I moved to inspector, and I've spent the last about 3 years as investigator. So nice to meet you all.
And if I might point out, Sarah is the only investigator dedicated to a board, and it is this board. So board members, I guess I'll go down the list, Amy, unless you want to go down the list and have everybody introduce themselves.
Sure, I'm happy to start. I'm Amy Brown, and I'm the vice chair for the Long-Term Care Administrators Board, and have served in senior living for kind of close to Jennifer's time frame, around 25 plus years, and I work as the regional director of operations for a local senior living organization.
Christine?
Hi, I'm Christine Prather. I've been a nursing home administrator for 16 years. I'm in Klamath Falls, Oregon. I was on the original Nursing Home Administrators Board for 3 years and this one for 3 years. So I'm just hanging out until someone comes to replace me to represent rural Oregon. So happy to be here.
Thank you. Maggie?
Hi, I'm Maggie Hilty. I am filling one of the seats of the licensed nursing home administrators. I've been a licensed nursing home administrator for 8 or 9 years now. I don't want to do the backwards math. I've been in long-term care for about 10 years. And this is my first full term, but like year 4 with how the board ended up working out. So happy to be here.
Catherine?
Hi, I'm Dr. Catherine Kolinich. I have been a physician since 2009. I was the chief medical officer of a long-term care company that had senior living facilities until last year, 2021. I'm honestly not sure how long I've been on this board, somewhere between 2 and 3 years. I currently work with an independent review organization that manages appeals. So we see quite a few long-term care types of cases, and I'm very invested in the quality of care provided to our seniors in Oregon. I remain a hospice medical director and still see patients in facilities. And just, I'm pleased to be here. I always learn something new at these meetings.
Thank you. All right, so we have some items for board action next on the list. And the first item is the approval of 2023 meeting dates. We have March 7th and September 12th. So those of you who can do it now, take a look at the calendars and see if we're going to be able to make those dates happen. If not, Anne was kind enough to provide me a calendar So maybe we can work through it.
I don't really plan anything that far out, so like, I'm good. Looks good to me.
Same, and you indicated March 7th and September 12th?
Yes.
Okay,
That's okay, we just need a motion, a second, and a vote.
Yeah, so if everybody looks at their calendar and it looks good, we need a motion, and then we'll need to do.
This is
Go ahead.
Maggie Hilty, and I move to approve the sorry, the dates. I motion to approve the dates for our meetings.
Right. Second the motion.
Okay, it sounds like
All
Mr.
right.
Weiss did the second. We'll need a roll call.
all right, a motion has been made and I'll call roll. Maggie Hilty,
Yay.
Christine Prather,
Yay.
Catherine Kolonic,
Yay.
Carol Hankins,
Yay.
Samuel Weiss,
Yay.
and Jennifer Brodbeck.
Yay.
All right. It's like motion carries.
Chair, vice chair.
So next on the list is the approval of chair and vice chair. So let's see, Amy. Looks like you can be around for a while. I don't know if you want to.
This is Maggie, and I would love the opportunity to serve as either chair or vice chair for this next round. Whether Amy, you want to keep doing one or the other, I would just love the opportunity.
Maggie, I would welcome that opportunity for you.
Thanks, Amy.
So which one are you nominating yourself for?
I am nominating myself for chair.
Okay, so we have Maggie Hilty as nominating for the chair and Amy Brown for vice chair. We need someone to second it, or if there's discussion, we can open up for discussion.
This is Catherine Kolinich, seconded.
Maggie motioned it, and
Mhm.
Catherine. You roll call.
And a roll call.
Roll call, okay. A motion has been
Please.
made. I'll call the roll. Maggie Hilty,
Yay.
Christine Prather,
Yay.
Catherine Kolonic,
Yay.
Carol Hankins,
Yay.
Samuel Weiss,
Yay.
and Jennifer Brodbeck.
Yay.
All right, well, we're just whipping through this agenda. Next on the list is the director's report. So as I said, I'm the interim director, and Trampus is the interim regulatory operations manager. HLO currently has 17 boards and councils that we're regulating, and we are bringing on a new board, and it's I'm sorry. Oh, okay. Amy, did you include yourself in the last?
I apologize. I must not have Amy Brown. Yay.
Okay.
Do you want me to redo the roll call?
Yes, please.
Okay.
And this is for nomination of the chair and the vice chair.
All right. A motion has been made. I'll call the roll. Amy Brown, yay. Maggie Hilty,
Yay.
Christine Prather,
Yay.
Catherine Kolonic,
Yay.
Carol Hankins,
Yay.
Samuel Weiss,
Yay.
and Jennifer Brodbeck.
Yay.
All right. Thank you. Sorry about that, everybody. Someone didn't hear Amy and they brought it to our attention. And this is what we'll do as we go through the board meetings. And if something gets missed, somebody always is attentive enough to bring it to our attention. So as I was saying, we're bringing on a new program. It's not really a board. So HLO is an organization, an office within public health that typically deals with boards. cosmetology, body art, electrology, your board, and several others. But we're getting a program that's called the Temporary Staffing Agency. And that is different because currently it is a general fund program, and HLO typically doesn't do general fund. We're working on identifying the agencies that provide temporary staffing, medical staffing. So that could be nurses, doctors, respiratory therapists, which is one of our boards, and alike medical professions. And in that, there will be what they're describing as rate capping. So exactly what that looks like, I don't know. At this point, there's a program, actually some stakeholders that are working on all that, and then they have to bring a report back to legislature after the first of the year. Any questions on temporary staffing that I could try to answer? Or Ann can help me with it. She is the policy analyst that is working with us on this.
I have a question, Bob.
Sure, Maggie.
Does that include CNAs, nursing assistants?
Yes. Other news is we have 2 more folks that are going to be confirmed by the Senate prior to the next board meeting. And then we'll have a full contingency of board members. However, there's always a but. So Christine Prather is currently serving until replaced, and her term actually expired in September, at the end of September in 2021. So she's been gracious enough to stay with us. But I'm sure by the next board meeting, she will have contacted Derek. All right, and so while I'm on this, see, Amy, your current term expires at September of 2023, and you can reappoint. Maggie Hilty, yours as well, at the end of September in 2023, and you can reappoint. Dr. Kolenich, yours as well in September of 2023, and you can reappoint. And everybody else, Jennifer and Samuel and Carol are all new. So thank you all very much for taking time out of your day and to spend it with us a couple times a year. All right, moving on. So those of you who have your computer on screen on and are looking at the board reports, I'm going to be looking at the nurse license issued to nursing home administrators, and license issued in Q4 of 22, we had 16 issued, and Q1 of 23, there's been 8. And so over the last biennium, we've issued 91 licenses.
Bob, will you give us just a quick refresher of what those time periods mean again? Because they don't.
Oh, yes.
These yours are
Thank
weird.
you very much. Thank you very much. Fiscal year. So in government, I'll try to use Sylvie's words and not butcher them because she always was very eloquent about it. Government, the calendar is messed up. So our fiscal year starts July 1. And every 3 months from July moving forward is a quarter. So Q1 is going to be like Q1 of July fiscal year 23 is going to be July, August, and September. And then every 3 months beyond that is a different quarter. Does that make sense?
Mm-hmm.
Okay. You guys are too nice to me. I would have said no. Residential care administrators, we've issued in the last biennium 4 419. So in Q2 of fiscal year 22, we had a nice spike of 126. Licenses renewed. What this tells us, if you're looking at it, are whether they're renewed online or by paper through the mail, or they come in and renew it. So it's almost even across the board on who's doing what, but we definitely encourage administrators to do it online, and then we can look at potentially some cost savings down the road. Licenses by age and gender on the next slide appears to be about a even split between male and female. And some of the longest serving administrators, we have a couple that are between the ages of 74 and 81 that are licensed. I'm not saying that they're working or doing or that. And then we have one between 82 and 89. Residential care administrators appears to be predominantly female, and it looks like, again, we have some folks that are maintaining their license at least between the ages of 74 and 81 and 82 and 89. And it's nice to see at the front end of the spectrum that there's younger folks coming into the business. Licensing trends, administrators in training. It looks like a huge dip, but it's it's just graphics. There's not been a whole lot, but currently we're in this quarter, we're at 34. Nursing home administrator trends. So we are at 343 in this current quarter, and we're in the 300 range, bouncing from the mid 300s, pretty static. Licensing trends for provisional care administrators. And so this will probably be the last time that the board sees this graph, because that was just for a period of time. And as you can see on that graph, it has dropped to 0 and stayed there for 2 quarters. We don't issue that anymore. Licensing trends for residential care administrators, growing. In 2021, the first quarter, we're at approximately 590, and currently we are about 810. Your financials. Your financials are good. They're not too far apart. Over 100,000, 120,000. So for the new board members, if you can see this at the bottom of that report for the long-term care administrators board, the financials, shared assessments. So what that is basically is every board pays a piece of what it costs to run the agency. And because it is a small board, and that means based on the number of licensees, and your assessment in that area is a little higher at 9%. And examinations, there is not a lot of work that goes into that. If I remember correctly, it can be done on workday, and there's very little cost to administer that exam. Any questions that I could try to answer? If I can't answer it, I definitely will get an answer for your question. No. All right. Next on the list is the regulatory report.
Bob.
Oh, Samuel has his hand up.
Oh, I'm sorry, didn't see it. Mr. Weiss. Did you have your hand up?
Weiss, is the fact that we are meeting virtually impacting the budget in that there's actually expenses not occurred by actually being and having overnights and that sort of thing?
Yes, sir, that's correct. I don't know the geographic qualifications for somebody to have to come to Salem and spend the night. As I understand, it's probably, X number of miles to travel, and then somebody would have to spend the night. And HLO or the board absorbs that cost. And then when we have everybody in the office prior to the pandemic, we provided, if the board meeting was expected to last beyond lunch, the board provided lunch for all the board members. And so I think that's about it. So there is an expense, but it's not a huge expense in the grand scheme of things. Okay. All right. Did you have another question, Mr. Weiss?
No, thank you.
Okay. All right, sure. If you can, you know how to take your hand down, because otherwise we'll keep calling on you and asking you if you have a question. Oh, it went down. All right, very good. Thank you, sir. So Trampus, can you get online and give us the regulatory report?
Here.
Thank you.
All right. So as you can see, if you guys can see the regulatory report here, there are currently three bienniums that are still left on the regulatory report. You can see kind of that top little section there. It talks about the open cases, and below it are the closed cases for the corresponding biennium. So as you can see, the 2019 biennium, we still do have 7 that are currently open. Some of those will actually coming for consideration today. And then of that biennium, 41 of the 48 have already been closed through previous meetings or other processes. So, and then you can kind of see as it moves through the 2021 biennium, 2023 biennium. The one thing I can say about these numbers, we have 50 open cases that are currently still being investigated or in some stage of being investigated or being closed out. And, so as Bob pointed out earlier, you guys are the only board that has a full-time investigator that's assigned to the board. All the other 18 programs split 3 or 4 investigators at any given time. When Sarah came on, there was a considerable backlog. Currently, we're closing more cases than we bring in, so the backlog is shrinking. And I know that the board and everybody has been doing a lot of work over the last several years to get that cleared up. So that's kind of where we are. Like I said, you can see we got 50 open, but like I said, some of those are actually coming to the board at a later time in this meeting for consideration. So, did anybody have any questions about this report?
Okay, very good. Moving on, you ready to step over? Ann and I are going to switch seats.
Everybody, hi again to our new board members that I spoke to earlier this morning. So we have a little bit of housekeeping. The board that existed before understands and remembers House Bill 2011. And this is from 2019. This was a bill that came forth requiring the boards that were listed in the statute to require these board licensees to take continuing education and cultural competency. if you remember correctly. When this first came out and I brought it before the board, it was decided that to keep things simple for our licensees who have to track a lot of stuff, to make this requirement annual, that they had to do their 1 hour in cultural competency every year, and it would be simple for them. As this got rolled out a little bit further and the DOJ took a little closer look at it, it was decided that we couldn't require every year, that we had to go ahead and follow the statute. As I mentioned to my board members this morning, we had to follow the statute exactly, which says that you have to have an hour in cultural competency every other time you renew. So we had to take the rules that we had previously passed that said that you had to have it every year and bring it in alignment. So now it's every other year. And we had to go through the rulemaking process, which again, put it out for public comment. What do you think? We didn't get, as you can see from the report, we didn't get any response. So what we would ask you to do today, if you have any questions on the rule, I can certainly answer them. But essentially it's a formality. We will need you all to make a motion, and if you don't have any questions, and a second and a roll call adopting the permanent administrative rule requiring an hour in cultural competency every other year. Does anybody have any questions on that process? Okay. Wow, I love this group. So if you would all be so, again, you know, we try to make things as simple for our licensees as possible. They're tracking a lot of stuff for their national associations, for different certifications. We try to make things align and be as simple and seamless as possible, but every now and then we got to do it the hard way. So here we are. So if you all would be so kind as to make a motion, any questions, please, are welcomed. Otherwise, I need a motion, a second, and a roll call to adopt the permanent rules.
This is Maggie Hilty. I make a motion to align the rule requirement for the CEU cultural competency renewal to align with, what is it, House Bill 2011?
Correct. Thank you very much. Do we have a second?
This is Carol Hankins, second.
Thank you, Carol. Can I have a roll call, please? And let's include ourselves. Thank you.
The motion has been made. I'll call the roll. Amy Brown, yay. Maggie Hilty,
Yay.
Christine Prather,
Yay.
Catherine Klonick,
Yay.
Carol Hankins,
Yay.
Samuel Weiss,
Yay.
and Jennifer Brodbeck.
Yay.
Thank you all so much.
Thank you, Ann. Thanks, everybody. Thank you for making this meeting go quickly. All right. Amy, you have public interested parties feedback. You have a script to read.
Yes. Public interested parties feedback. At this time, the Long-Term Care Administrators Board will hear public interested parties feedback. Members of the public, please wait until you have been recognized. Once recognized, please state your name and affiliation to the board for the record.
Hi, this is Bob with HLO. For the folks on the phone, I thought we had one person and perhaps a second one had got on the phone. Do either of you want to make a public comment?
This is Nicolette Rowley from the Oregon Healthcare Association.
Good morning.
I just have a quick, good morning. I just have a quick question about the new temporary staffing group that you mentioned at the beginning. I was just wondering, is that going to be an actual board that you guys, the HLO, will be managing, or is that a registry, or are you just doing licenses? And then my second question is, you mentioned rate caps on that, and I was curious how that process would work.
I will let Ann step in.
Good morning, Nicolette. It's so wonderful to hear from you again. So a couple of things. This particular bill created a program where we would be licensing not individuals who work for these companies, but the actual companies themselves, the temporary staffing agencies themselves. Part of the bill that created the licenses for these entities, Section 15, is requiring a group at the Oregon Health Authority to look into policy recommendations for the establishment of annual rate caps that these agencies may charge for their services. That is due to the legislature at the end of the year, 2022. Based on that, the legislature can take any number of actions, right? So we're kind of waiting right now to find out what that report is going to look like. They are looking at regional prevailing wages, what would be considered reasonable to charge in those areas. As you understand, this came about from long-term care facilities and other medical service providers struggling to keep up with some of the rates that these temporary staffing agencies were charging for services. So while we'll be licensing entities, the rate capping, prevailing wage information is to come. We don't know what this report is going to look like, and we don't know what the legislature is going to do with that report. As I mentioned to my new board members, we are the hands of the legislature, but we do what they tell us to do. So does that answer your question, Nicolette?
Wages and those types of things. Who's gathering that information?
A great, terrific question. The economic arm of the Oregon Health Authority has contracted with a specialty organization that is doing the research into wages, expenses. They're doing all of that work and are working with the economists at OHA to produce that report. I believe I could look in my email and find maybe the name of the company that was contracted, but it is a specialty firm. Nicolette, I will see what I can do for you.
Thank you.
And if I could in turn ask a question, any information, we have struggled, and this is a really interesting ask from the legislature. We have been struggling to find out how many of these companies might exist. Normally with licensing, people want a license because they want third-party reimbursement. You know, they show up, they're like, here we are, there's 50 of us, you know, or there's 100 of us. And we price our programs accordingly, how many licenses will be issued and the risk associated with that profession. And some of them are really easy. Genetic counselors, there's 50 of them and they all work for hospitals and they're postdoc. Okay, it's pretty low, risk profession. And then you have higher risk professions. We know absolutely nothing about this. And these companies are difficult to find at best. Some of them are coming from other states. Some of them don't have brick and mortar. Some of them, it's like vapor. We're chasing vapor. And so we have no idea who they are, where they are, if they're going to come to Oregon, if they're waiting to see what these reports might come out regarding rate capping. And so if there's any information you can share with us, because at this point we're kind of looking for the tools we need to run this program, and we've been coming up empty, if I'm honest. So whatever you can find for us or get the information out there, we're going to need rules advisory committees. We're going to need participation. We're going to need lots of things. And if they could make themselves known or give us some numbers, we would be really grateful, Nicolette.
So there is a national and a state association that represents medical staffing agencies.
Mm-hmm.
I'm in my car at the moment, but I have his contact information, and I will send you his contact information when I get back into the office.
Yeah, if it's Toby Malera, we've spoken many times. But yeah, that would be really.
I don't know the top of my head. it's
Okay.
different than Toby, I'll send it to you.
I really appreciate it, Nicolette. Again, you know, you ask us, we ask you, it all works out. So thank you again. Any other questions about temporary staffing agencies, anybody? Okay, well, thank you, Bob.
Thank you. Nicolette, did you happen to send April an email? She hung up.
Yeah, I think we lost her.
Okay. So you make a note that was Nicolette.
Got it.
Is there anybody else on the phone left that would like to make comment? Hearing none. Okay, takes us out of public and interested part. I'm sorry. Did you say something? Okay. Moving on, executive session. Amy, I think you have script for that.
You bet. All right, entering into executive session, the Long-Term Care Administrators Board will now meet in executive session pursuant to ORS 1926602F and ORS 676595 for the purpose of considering information exempt from public disclosure at 9:47 a.m. on September 13th, 2022. Representatives of the news media shall be allowed to attend the executive session by conference call and will be provided further call-in instruction shortly. The public phone line will be muted for the duration of the executive session. Are there any representatives of the news media on the public phone line?
Hearing none.
Hearing none, recognizing there is no news media in attendance, the public phone line will be muted for the duration of the executive session. We will return to open session before taking any final action or making any final decisions. We are now in executive session.